I was diagnosed with stage 3 ovarian cancer. The statistics are scary for ovarian cancer, very scary. My family right now consists of 3 sons, and they have lots of questions.
The problem that we're trying to solve is how do we deliver better care, more coordinated care to the sickest 10 to 15% of the people.
You have those sleepless nights where you just have all these questions and not sure where to go for the answer.
We understand the medicine. I can talk about diagnoses and pathologies and medications. What we try to do is understand the human being. And we put the patients first. And we empower them to know what their disease or diseases are, what that trajectory is. And we engage with them, find out what their values are, what their desires, their goals are.
You have cancer, you know what you're going to do every day that you have cancer. You're going to fight it. You're going to do your treatments. You're going to see your oncologist. You're going to have your scans.
She went through surgery, chemotherapy, radiation, successfully completed all these courses and came to us post and said, now what?
I think that when you get that diagnosis of remission, you think, well, your problems are over, cancer's over, right? But you're left with a lot of things that you need to deal with moving forward.
The palliative care program puts everything together so the patient can understand that they have choices.
You need someone to help you with all those after effects. Personally, I have a lot of neuropathy from the chemo, and I also, emotionally was going through a lot with my kids and myself.
The palliative care, it talks to the patient, finds out what their goals are, what their concerns are.
In addition to cancer, to the actual cancer, I had a high chance of getting breast cancer, so I chose to have a double mastectomy. And so going through all of those different things, it's nice to have the palliative care program just offers you so much information. Helped me make that decision whether or not to have a double mastectomy. Helped me with the reconstruction process. Just emotionally, it's a lot to live with when you've been given that kind of diagnosis.
There comes a point where a lot of the bells and whistles that we have in healthcare, again, don't potentiate life expectancy or quality of life. They're things that we can do to someone. I think the focus is what are those things we can do for someone.
So my goal, I guess, originally was to deal with the neuropathy, and I think I got so much more than that out of the program because they really helped me look at the whole diagnosis and my whole life.
I find palliative care, being part of the team, very rewarding. When you can answer someone's questions.
Personally, this opportunity here in Fort Dodge has been a really positive overall influence in my life.
I don't want to always think of my life every day of being a cancer survivor or in remission or whatever it is. I don't want to think about it, and I think Dr. Tim and the palliative care program helps me so that I'm not thinking about that, so I'm just living my life, that I don't need to worry about that as much. This is how it fits, this is how it works, it's part of who you are, and how do you want to live your life, and then they help you live your life that way.
We are offering engagement based on her values. We're not there knocking at the door every day. We're accessible. We're not going to abandon her. It's not going to be, your pain is better. Okay, see you later, go back to your primary care physician. We're here for the journey.
But again, I decided a long time ago that I wasn't going to be a statistic. Dr. Tim has made that absolutely clear, that I'm not a statistic, and that it gives me the comfort to go home and tell my kids that I'm going to beat those, So, yeah, sorry.